Alright, how many of you guys are familiar with HIV and AIDS? So basically what it stands for is human immunodeficiency virus acquired, and AIDS stands for acquired immunodeficiency syndrome. Today I'm going to talk about what it is, how we can prevent it from happening, and some foundations that are working towards a cure. What is HIV/AIDS? Basically, according to the United States Department of Health and Human Science, 1 in 7 people are living with HIV today and are unaware of their infection. What it is that it starts with HIV. We have something in our bodies called a T cell, and once the HIV cell gets in there, it replicates until our immune system starts failing and we start catching diseases such as cancer and infections. We can no longer fight them down. If you have HIV, you can live up to 8 years with it until you obtain AIDS, which is the last stage. It's treated but not curable yet. It has 3 stages. It's the acute infection, the clinical latency, and the final one, which is AIDS. Who is at risk? Up to 2016, according to the World Health Organization, about 40 million people around the world have AIDS, and 20 million of those people are women, and 2 million of those people are kids. Why kids? Because when women, it is transmitted through sexual fluids such as vaginal fluids, semen, and breast milk. So when a woman is pregnant without knowing she has HIV, she spreads it to the child through breastfeeding. In the beginning, like around the 80s, there was this whole thought that it was only for gay people, because it started out, there was like a whole outburst, and it was mainly between gay people, but then later on they discovered that other people could get it as well, such as women and children. That's why it was named the human immunodeficient virus, other than something else. The symptoms in the beginning, it can be asymptomatic, which is why 1 in 7 people living with HIV today are unaware of it. But later on, it starts with sore throat, bad yeast infections, feeling really tired, dizzy, weight loss, and it leads to skin cancers and other infections. Now that I told you guys a little bit about what it is, I will lead you guys to preventions. Okay. A way to prevent this, basically, using a condom every time you have sex. Tell your sexual partners if you have HIV in order to prevent, in order to prevent it from spreading around. Use a clean needle if you're taking medications or whatever. Make sure the needle is clean, especially when you're getting tattoos. If pregnant, get medical care right away, and consider pre-exposure prophylaxis. Basically what this is, it's a pill that they offer you to avoid, even though you don't have it, you can avoid from getting it. Some treatments are VR, which is otherwise known as antiretroviral therapy. What this does, it does not cure this, but it helps you to live a longer, normal life. And the diet. The diet is very important to a person who has this virus, because it helps to remain the energy levels up and from you getting any more infections. Now that I told you guys a little bit about the preventions, I will take you guys to a foundation. It's called SMAID, which stands for the Secretary's Minority AIDS Initiative Funds. This fund donates $54 million a year to improve HIV resources in minority communities like those of colors and those with low income. It expands care for people that live with HIV in order to better their probabilities of living a longer life with treatments such as the PrEP pill. With that said, I conclude with telling you guys to take action. If you are still unaware of what it is, visit hiv.gov or go to Planned Parenthood. Check yourself. Thank you.